Welcome to Medicine Handy Point. Today we'll discuss the clinical signs in chronic liver disease due to different etiologies. So let's discuss that. Now, clinical signs which can be seen in CLD due to hepatitis B and C infection, they can be stigmata of chronic liver disease, which includes leukonychia, pulmonary erythema, hepatic phases. Hepatic phase is a kind of phase in which the nose will be pinched, there will be melaprominence, sunken eyes, and shallow temporal area. So there will be hepatic phases, spider angiomas, and definitely ascites and dilated veins will be present. You can see tattoo, IV injection marks, surgery marks, because it can be transmitted through blood transfusion, through the surgical procedures and tattooing, so they can be seen. Palpable purpura occur in cryoglobulinemia, which is associated with HCV infection. So these are the signs which can be seen in CLD due to hepatitis B and C virus. Now, clinical signs in primary biliary cirrhosis, they are: patient will be young female mostly. There will be stigmata of chronic liver disease, which we discussed in the previous slide. There will be jaundice. There will be xanthelasma around the eyes. There will be xanthomatous deposit near knee, ankle, palmar creases, and elbow. And there will be scratch marks due to itching. The itching is a very important feature in primary biliary cirrhosis, and irretractable itching is an indication for liver transplantation as well. So these will be the signs which can be seen in primary biliary cirrhosis. Clinical signs in hemochromatosis are: there will be again stigmata of chronic liver disease we discussed earlier. There will be brown to gray pigmentation of the skin, and there will be arthritis, and those will be the signs there. Now, clinical signs in Wilson disease. Clinical signs in Wilson disease, which can be seen, are a stigmata of chronic liver disease, which we discussed earlier. There will be cave rings, Kaiser-Fleischer rings in the cornea, and there will be neuropsychiatric symptoms. There may be tremors, there may be ataxia, there will be chorea, athetosis, and there may be depression, psychosis. So these are the signs which can be seen in Wilson disease. Now, the clinical signs in non-alcoholic fatty liver disease, these include stigmata of chronic liver disease, which we discussed earlier. The patient may be very obese, and a patient may be hypertensive or diabetic, but mostly if the patient is not fitting into other causes for chronic liver disease and patient is diabetic, so long-standing diabetes leads to fatty liver, which is steatosis, followed by steatohepatitis, followed by fibrosis and cirrhosis. So I hope you like the video, and please subscribe to the channel.